What can be done about behind my ears for red skin, ridges, and scars? Please, now I am 7 months post neck facelift. I have reddened skin, ridges and white scars behind my ears, a very tight scalp, and sore tightness around ears. Plastic surgeon attached my lobes, but they weren't before. Now I have little pixies and pockets behind which are sore and tight, and they will need a release. He says he did me extra tight for a good result, but I think he may have pulled me too tight. The scars have now moved from behind my ear and widened, so now I can't wear my hair back. I still have some swelling and discomfort under my chin. Thank you.
Thank you for your question. In the world of facelifting surgery, certainly your concerns and results is not that unusual. You know, there's a lot of discussion and debate about what the best techniques are and how much tension to put on the skin. But the reality is that there is art of doing the surgery, and then there is the way the patient's body heals. And anyone who has experience with facelifting can recognize that the challenges that you are dealing with, such as the widening of the scar behind the ear, the thickening of the scar behind the ear in the crease, as well as maybe some pulling down of the earlobe, is something that a lot of experienced surgeons have had to deal with in their own patients. So your plastic surgeon saying that he or she pulled you extra tight is not unusual, because sometimes you have to pull someone extra tight because their elasticity, their skin, is such that you can anticipate from experience a certain amount of regression. So, you know, there is the how a person looks when you do the surgery and the application of the proper closure and, you know, the amount of tension, and there's how someone heals. In almost every surgery that is done in the field of cosmetic surgery, the long-term healing factors are almost independent of the initial surgical technique. So, for example, tummy tuck surgery, incision, you know, the bikini line incision can be beautifully done, closed very nicely and nice and thin, and yet the scar can become wide or thickened. And this can apply to any place in the body, including facelifts. So the question that has to be addressed is, how do you deal with what's going to go on moving forward? Well, I would say that when a situation is such that there is a maturing process going on, and surgical healing really is about 1 year. Now, what that means is there's something called collagen remodeling or tissue remodeling that goes on as that year progresses, so that if any type of scar revision surgery or any other adjustments need to be made, you want to have as much skin to work with that isn't too tight. So I think of the things you're concerned about, such as the widening of the scar and the incision behind the ear. Sometimes people can camouflage the scar with the hairstyle. A lot of times, and I know this from doing hair transplant, the hair follicles that are inside the scar go into a shock phase. And with time, hair can grow out through the scar, especially when it's done in a particular angle in terms of the initial incision. And if that was still not the case, and you wanted to wear your hair back, then you may need to consider a scar revision, or in some cases, the placement of hair follicles, basically a hair transplant. And that would probably address anything about the widening. As far as the thickened scar behind the ear crease, we routinely would use a combination of what's called 5-fluorouracil and a drug called Kenalog, and inject that area so that the scar would soften and it would become flatter. And then last but not least, anything related to, quote, pixie ear deformity, where there's a pull, it just depends on how much skin is available, okay? If your incision heals very nicely, or even if it's a wider incision, but your skin is light, and you're able to kind of camouflage that area, sometimes it's just a relatively minor procedure to just get that ear to be tucked back in. And in other cases where there's a lot of drag, it's a little bit more challenging because you have to really move skin up. But if there's not enough skin to move up, then you don't have a lot to work with. A lot of my patients who come via referral for pixie ear deformity correction will often be 5 to 10 years out from their initial surgery, so now they have enough skin, so they actually benefit from having another lift and then revising the pixie ear. But nonetheless, it is something that is doable, but again, it depends a lot on how you heal. So usually, in these cases, there's a combination of management during the postoperative healing period, and then at the 1 year maturity point, you can make some decisions about what you can do that would be okay for you to get the result that you want. So although it's naturally distressing to have these things happen, it is stuff that everyone deals with, and as long as you feel comfortable and confident with your surgeon, then I would suggest you continue following up with the doctor. So I hope that was helpful. I wish you the best of luck, and thank you for your question.